Hello, we're speaking with Megan Maslenka of Drexel Medicine. Is that correct?
Yep.
And she's going to speak to us about the Streetside Health Project and her experiences in the Streetside Health Project. So first off, Megan, why did you decide to begin volunteering with the Streetside Health Project at Prevention Point?
Well, I found that I loved working with student clinics in general. We have four at Drexel. And I came to Streetside and something just resonated with me. I loved the patient population. I felt that I learned so much here and that something was just different from the other clinics. And so when it came time to pick new coordinators for the following year, I decided I wanted to apply to be a coordinator here. And to be honest, this has just been the best experience of medical school for me. And there's nothing else I would have rather been doing. It's been fantastic.
So you say you're a coordinator. What type of coordination have you done in working with the Streetside Health Project?
So we have a Friday clinic every week. And in order to have that, we have other coordinators who work to put this together. And there's a pharmacy aspect, there's a physician scheduling aspect, a student scheduling aspect. We coordinate with Prevention Point and so forth. And the whole trick with anything is just to make things run smoothly. And priority is to have clinic running as many Fridays as possible, to be there for the patients, to operate well, to have a very open, safe, non-judgmental environment for patients to come to and to keep that going every week. So we see our job as making that run smoothly and doing what it needs to take to make that happen. Sometimes there are snafus, but there was one today, but we try to minimize those as much as possible and just keep it going.
Have you seen any conflicts with, let's say, the medical model and, say, harm reduction? And, how do you, as a soon-to-be doctor, work through those?
I love the harm reduction model. I think it's fantastic, and I agree very strongly with it, and I really think it works. There hasn't been a lot of conflict that we've been taught, but I think you see in med school, people come in with some strong opinions. So one thing I think is really important is for people to be exposed to different opinions. Some people are against the harm reduction module and think that it may be harmful, but I think when they come to a clinic and see it in action, it shows them why it works better and why, of course, somebody is going to respond better and get more help from interacting with somebody who's operating off of that model versus someone who isn't. It's all about the patient. And I think a good physician, I'm not one yet, but two more years, and I want to be a good one. A good physician puts the patient first. And that's what you always have to keep in mind. You have to make sure that patient's comfortable and make sure that patient wants to keep coming back.
Thank you. You may have said some of the most important things, but if you had to list some important things you have learned from volunteering with the Streetside Health Project at Prevention Point, what would they be?
Oh wow, important things from volunteering. Everything. I think the best thing I've learned is how to really connect with a patient. I don't think I would be able to do that, even with my past experience or what I've learned at school. I don't think I'd be as good at that if it weren't for here. And here I've met some amazing people, and I've just loved the patients I've worked with. And over time, I've gotten to learn what I need to do for them to trust me more, and for me to be a better medical professional, because that's what it takes. You have to have somebody who wants to talk to you, who wants to work with you, who thinks you'll be good at it, and there are certain mannerisms that come with that.
how important do you feel is forming a relationship from client to doctor or medical professional when you're working with each other? You know, how does that open doors to, to education as well as just getting more out of that client?
Oh, it's huge. It's huge. You're not doing your job if you're not doing it. You're missing at least half the story. If you say something the wrong way, you can easily make somebody uncomfortable, and then they're not going to open up to you, and then you may never uncover what's really going on. And if you're not uncovering what's really going on, you're not really helping that patient. You're not even addressing why they're really there. And a lot of times you see, sometimes people just really need to talk, and if they feel safe with you, they'll do that, and they walk away feeling better having had that opportunity. And I think especially here, there are a lot of patients who have no one else to talk to, so it's a very important thing to provide.
What would you like to tell future volunteers who are doing this program?
I'm jealous of you because you are walking into the most amazing clinic. It's incredible for so many reasons. Streetside is so special, and they do such great work, and they have such wonderful patients, and they have wonderful people in charge. And take advantage of this opportunity you have, because it's unique, and I've never seen anything like it. And like I said before, it's hands down the best medical experience I've ever had.
Thank you very much.
Thank you.